Imperial Valley's AM 1230 Kxo, El Centro, California. And as we have been doing for 8,942 weeks, we are going to update the COVID-19 situation in Imperial County. And with us on the phone today, socially distancing, we have Imperial County CEO Tony Rouhotas and Public Administrator, also head of the Area Agency on Aging, Rosie Blankenship, with us today. Good morning.
Good morning.
Good morning, Carol.
Okay, let's get started with just a brief look at the numbers for Imperial County. And as somebody that has been following the health department's dashboard almost from the get-go, we are seeing some improvements.
Absolutely. So the improvements are definitely showing on the positivity rate on the 7-day percentage. Today, from yesterday's numbers, we were down to 11%. That's extreme change of where we were a few weeks ago when we were hovering around 29, close to 30%. So over the next few days, we're hoping to see that continually trend downward, which is where we need to be. We want to be at that 8%. We need to be there for 14 days. So that's definitely a number everybody keeps looking at, and we need everybody's assistance to keep that moving in the right direction. Okay,
and we will point out one more time. Actually, we'll point it out a number of times. The OptumServe test sites in Brawley, Brawley, Imperial, and Calexico are open 7 a.m. till 7 p.m. and starting next week, Tuesday through Saturday. Yeah. And the testing is free.
Yes, absolutely correct. Testing is free. We ask everybody to go out and take advantage of that. The bigger point is they are shifting days to make Saturdays available, which I think is extremely important for people that are working or have other commitments throughout the week. So by shifting it from Tuesday to Saturday, we hope to gain more people that are available to take advantage of it. And let's take advantage of it because it is free. And it's open at all 3 locations. Imperial actually has 2 lanes. And we need to keep that going. It was a huge undertaking to obtain the ability to have this many lanes open within Imperial County, so we finally have it. We don't want to lose it. We need to maintain the numbers. So if you haven't been tested, I ask that you go out, make an appointment. Appointments are happening really quick right now, and that's because we have the available space. Let's take advantage of it.
And one thing that we have pointed out, get tested, and that will help bring our numbers more in compliance so we can open a few more things.
That's correct. You're absolutely right. So we need that support.
Okay. Early on, only people that were displaying symptoms were getting tested. Now, anybody and everybody should get tested. It's available. It's free. It's painless. And go for it. Get those numbers more in compliance with the state requirements, and you're going to be able to do a few more things.
That's what we need, boss.
Okay. Rosie, good morning.
Why, good morning, Carol.
You are looking lovely. Your facial covering matches your outlook, bright and sunny.
Well, I am feeling just wonderful.
Well, good.
Carol, we're having a good time today, and I thank you for having us on the radio. Good morning, Imperial County.
Okay.
And, with us today as well is the Assistant Public Administrator, Sarah Enns. Just want to note it for everyone.
Okay, I always have to ask, Sarah, is there an H in Sarah?
Yes, please.
No, there is no H in Sarah. My daughter Sarah is a testament to that. S-A-R-A. Anyway, I always have to bring that up. The Area Agency on Aging, which is under your department, has been very, very busy from the get-go. You were busy even before this, but what are you up to?
Indeed, we have, Carol. It's been incredible. Immediately after the governor's stay-at-home order, was issued, that following day, the AAA put it in high gear and had to transition all of our congregate meal sites, which are 10 in our Imperial County, to pickup immediately. And so we, through IVT Ride, we started bringing in seniors just to pick up their meals and then take them back home. But soon thereafter, we realized that that's not something we want to be promoting, is bringing older adults out once you have a stay-at-home order. So a few days after that, we decided that we would transition to a home-delivered meal to the 300 seniors that we had at the time. Within a week's time, those numbers increased to over 500. So trying to put all of the delivery services together, ensuring that our service provider, Catholic Charities, had the manpower to prepare the meals, was quite the endeavor with Sarah, and she'll kind of jump in and tell you all that transpired just to do that, and all the team players. But it was an incredible task to put through. To date, we're serving approximately 833 seniors with a home-delivered meal. And Sarah, why don't you tell them what we're doing in that area?
Good morning, Carol.
Good morning, Sarah.
With our home-delivered meals, we, at the beginning of the pandemic, as Rosie mentioned, it was a huge undertaking. We were fortunate enough to have the probation department step in and help us deliver. Our staff helped deliver every afternoon. And most recently, we've gotten some restaurants on board to help us deliver and prepare the food. It takes a lot of manpower. It takes a lot of logistical planning to figure out how to get our seniors fed. But we know how important it is for them to receive a nutritious meal each day.
Yeah, and so with that, as we started making more contact with older adults in our community, we immediately saw the great need for food. We have a 23% food insecurity amongst older adults in our community, Carol, and it's very disheartening. We know that we've got to get food to them, and we had enormous participation from the community with donations to be able to purchase some of these emergency relief items, as well as partnering with the Imperial Valley Food Bank to provide emergency food boxes. So one of our first sponsors was the Imperial Valley Masonic Lodge with a $5,000 donation, wherein we were able to purchase just basic items, Carol, such as, toilet paper, hand sanitizer, personal hygiene items. Fortunately, the American Red Cross jumped in quickly and helped us with comfort care items, which basically included everything we need in personal hygiene. And so those went quickly. And because we wanted to promote, older adults staying home, obviously needs are going to grow. How do you get groceries to them? How do you get their medication to them? So working with the Imperial Valley Transportation Commission through IVT Ride, IVT Access, we had to enlist help to purchase grocery items, go to the pharmacy, pick up items, deliveries, just coordinate a lot of services that needed to ensure that older adults were safe and well at home. But with that, then we immediately started seeing that loneliness, depression, isolation kicked in. And so we were fortunate to establish a call center early on through the help of behavioral health. Behavioral health technicians were on hand, able to handle the increased loads of call volume that we received, because so many needs started arising. And so just to give you an idea, we at the AAA would get maybe about 50 calls a month. That jumped to, in one day, 300 calls a day coming in to get older adults calling for assistance. And so we had a call center of about 6 behavioral health employees. that were an amazing asset to our department. They were able to triage older adults that were calling, crying, needing help, so many expressing depression, and to have behavioral health staff on hand to be able to assist immediately was amazing. And then to get them connected to services through behavioral health was one great task. The California Department of Aging also set up a California Friendship Line, which helped to assist those also needing a warm line for someone to talk to. But then we also noticed that wasn't enough. We needed to do more. We needed to start checking in on older adults in our community. So soon thereafter, we enlisted the help of the National Guard. Many people were a little wondering, what is going on? Why is the National Guard coming into our community? Martial law setting in? What's going on? So it was really nice to see everybody, the teams working together, our PIO, the JIC committee, to help, lessen what was, rumors going around that, the National Guard was really here to help the AAA and the food bank to help services get across in our community. And so the National Guard immediately helped to start delivering some of the emergency relief items in our community, as well as, and most importantly, starting the wellness calls. So through the efforts of our National Guard, we were able to make over 3,500 wellness calls to older adults in our community. And by doing so, they would check in, asking them, how are they doing? What kinds, what do they need? Are they keeping in touch with their loved ones? Do they need any special services? And through that, we found out that there was a great need for services. So we were able to quickly provide them with the wraparound services that were needed. But during this time, too, we received funding through the Imperial Valley Continuum of Care to carry on homeless services. And that was another huge endeavor that Sarah stepped in and started working on. Sarah, why don't you let them know some of what we did with the homeless?
Hi, Carol. This is Sarah again. With our homeless population, they're also very vulnerable, especially during the pandemic. So getting them housed for a few weeks at a time to get them off the street, especially if they had underlying health issues, was our main priority. I'm so thankful for our deputies who stepped in with me and were able to work weekends and nights and get our homeless placed. Having them placed also gave us the opportunity to reach out to them, talk to them, see what other services we could provide for them, whether it's getting them on payee representative services or if they needed to get to behavioral health. Also providing them with food and water. We were able to, with the food boxes, the donation money, able to get them food. We took food to the hotels where they were placed, and it was nice to just see the joy in their faces that they were able to have some shelter for a few weeks. Our program also targeted the population of 55 and older, so it was very rewarding to help our older adults get into some housing during this time.
Yeah, and then more recently, Carol, we were blessed with a $45,000 donation from Alice Power, half of which went to the Area Agency on Aging for Senior Nutrition, and the other half to the Public Administrator for Homeless Services. So with that, we're going to be able to place more homeless during this time, get them off the streets, give them a cool time of respite, provide them with meals and clothing and whatever needs, associated needs. So we thank Alice Power for having that passion for our community and supporting us during this time. Additionally, to that, Carol, Sempra Gas came in through the American Legion, and through their efforts, we're receiving $25,000 worth of perishable items that consist of milk, bread, a dozen eggs, and a whole chicken that we are able to provide to Nyland residents that were displaced due to the fire, older adults in our community, the homeless. We have so many services in the public administrator's office, such as a representative payee program, We have guardianships, conservatorships. We assist families who have lost a loved one during this, financial hardship time. And so we are able to assist with many of the resources that we have on hand. The pandemic only exacerbated the problem. We need the assistance. There's so many vulnerable people in our community. Our agency is known as the Agency of Last Resort. And we are so proud. We have an amazing team that is ready to serve, a very small but powerful team that is ready to serve. Additionally, Carol, we have our long-term care ombudsman who has done an amazing job. Many of you know her, Carla Flores. She has worked closely at the Emergency Operations Center with the JIC, with the staff on hand, working to provide services to the long-term care facilities. Through her efforts, we've been able to connect loved ones that have been separated from their families for their protection and families' protection to avoid spreading the virus. She's set them up electronically to be able to visit and provide that virtual support that is so needed. And if there's anything we can say, Carol, to our community is please stay in touch. Stay in touch with your loved ones. If you have older adults, check in on them. Call them. They need someone to talk to. They need to be heard. When we started doing these wellness calls, you think you're going to call, just say hi and bye. No, these calls take anywhere from 15 to 30 minutes. They're eager to talk. They want to talk to someone. And that's the simplest thing we can do is just, give them a call, check on your neighbors, make sure that they're okay. If services are needed and you can't provide them, send them to our office. We'll get them connected with someone that can help. So I want to give the community our phone number. Our phone number is 442-265-7000. Again, that's 442-265-7000. This time is very tough for everybody, Carol. And we've just got to remember our older adults and our children. These are the most vulnerable, and we've got to protect them. And our weather here doesn't help. It really doesn't. We have so many that are struggling, and we've got to make sure that we're getting them the resources they need. And a lot of times it's just, sharing that voice and listening.
Well, one of the things that you obviously have stressed is reaching out, the personal touch, the human touch. And like you, we get phone calls throughout the day, people that just want to talk. And you're right. That is, the food and the other things are necessary, but oftentimes one of the best things is that human touch. And that, it is, it's needed. It's necessary.
Absolutely. Okay. And we just want to make sure that people know that they have someone that's here for them. And it's our agency. I want to thank my staff. I just throw out an amazing shout out to the Imperial County Public Administrator's Office, Area Agency on Aging. These employees have gone above and beyond. Many of them have not been able to take any time off, because why? They believe in what they do. They want to serve the public. They enlisted because they wanted to help, and they know that the clock doesn't end at 5:30. They keep on ticking. They have their phones ready and are available to help. So please don't forget that we are here, and we do want to make ourselves available to assist.
Okay, Rosie, Sarah, we appreciate the information. Tony, did we miss anything that we should tell everybody about?
No, I'm excited about the Saturdays on the testing being available for the community. So I just want to stress for the community to get out there and take advantage of the free testing opportunity. We don't want those numbers to go, the percentages of the use to go down too low, because we don't want them to move those testing sites elsewhere.
Take advantage of the testing. Again, it's painless, it's free, it will take you 10 minutes. They're able to schedule oftentimes same day or next day testing, and that will help get the percentages where they need to be. It's all a numbers game.
Absolutely.
Okay. Ladies, gentlemen, we appreciate the visit today, and stay safe.
Carol, one last thing to your people out there. If anybody is interested in helping our agency through the Workforce and Economic Development Department, they are accepting applications for paid positions to deliver and drive. So please contact our office and we'll get you connected, because with the National Guard leaving us today, we need the help from the community. Paid positions, call 442-265-7000. And like my boss says, we are Imperial County strong.
Thank you. And, we look forward to next week.